Okay.
Hello, my name is Brianne Darling, and I'm here to talk to you about scoliosis, the statistics, the signs, and the situation. Do you remember those random tests you might have taken when you were a child or a young adult at elementary school or middle school, where you had to bring a swimsuit to school and get called down to the nurse's office? You had to put on that swimsuit and bend over and touch your toes while the nurse looked at your back in weird positions. The tests you underwent as a child or young adult are to test for a medical condition called scoliosis. The signs and symptoms of this condition range from mild to severe, and they affect and impact every person differently. Once you know what the signs are, you should use your knowledge to enlighten close friends and family if you suspect they might have scoliosis based on signs they are exhibiting. I am one of the hundreds of millions of people affected by this condition. I am one of the thousands of people in the world who needed more drastic treatment. I was one of the ones who was not well informed early enough to possibly prevent my curve progression. Let's begin with the basics and crunch some numbers. Scoliosis is a sideways curvature of the spine, typically making a C shape or an S shape, like this one shown in my x-ray taken 6 years ago. It is normal for spines to have a slight curve in them, but it becomes scoliosis when the degree of the curve determined by a specialist exceeds 10 degrees. 80% of scoliosis conditions are specifically called idiopathic scoliosis, meaning their condition and cause is unknown. They do know, however, that children who come from a family history of scoliosis are 20% more likely to develop a greater curve than children who do not have a family history of scoliosis. This condition needing treatment such as brace or surgery occurs more frequently in females than males and is usually diagnosed between the ages of 10 and 15, or when the adolescent is at his or her prime growth period. Doctors are still unsure why gender has any factor in the development of scoliosis, but they do know that it has some sort of effect. Now we'll move on to the numbers. A curve of at least 10 degrees occurs in approximately 1.5% to 3% of the world population. Less than a 10-degree curve is not considered scoliosis by medical standards, as it is normal for humans to have a slight curve in their spine. Curves over 20 degrees occur in approximately 0.3% to 0.5% of the world population. It is estimated, although not known for sure, that less than 0.01% of the world population has a degree exceeding 50. Curves of this magnitude almost always require surgical treatment. In the perspective of just the United States, 5 to 7 million people are affected by scoliosis, but only 4 out of 5 of them have curves less than 20 degrees and do not require any treatment beyond periodic visits with a specialist. Now that we know that over 200 million people worldwide are affected by scoliosis, let's discuss a few signs to look for. A few signs that are visibly noticeable include uneven shoulders or hips, a curve or twist in the spine, the head not lining up with the tailbone, or one side of the upper back is higher than the other when the child or adult bends over with knees together and arms dangling down. This test is called the Adams Ford Bend Test, which I previously asked you to think about. It is usually done in elementary school or middle school, and if the school nurse does this test and suspects you might have scoliosis, he or she will refer you to a family practitioner to have further screening done. It is important to note that many people do not have significant enough curves to have visible symptoms that the human eye will notice if untrained to look for these abnormalities. If there is any suspicion that someone you know might have scoliosis, they should go see a professional and get an x-ray done to better determine if they have scoliosis, and if so, at what magnitude. Let's take a moment to put what we know about scoliosis into a real-life situation and discover the treatment options most frequently used. When I was 15, I was diagnosed with scoliosis with a 38-degree top curve and a 42-degree bottom curve. At the time, my doctor decided that I was probably done growing, so I would just come back in 6 months and see if anything changed. Playing the waiting and watching game is a typical treatment plan for over half of patients with scoliosis. With my numbers where they were, I was past the stage of needing a brace, which I was honestly thankful about. Back braces are used to stop the progression of the curve, and they can be very painful to wear because you have to wear them most of the day. It is also very controversial as to whether or not the brace is significantly effective, and my doctor did not feel it was necessary to try it out with me because I was done growing. 6 months later, however, I had grown an inch and my curves had increased to 48 degrees and 54 degrees, respectively. It was then determined that if I did not have surgery, I would most likely end up with arthritis in my back by the time I turned 30. So my surgery was scheduled for June 29, 2007. Unfortunately, the cause of 80% of scoliosis cases is still unknown, but that should not stop people from becoming informed of the statistics, the signs, and the real-life situations of scoliosis patients around the world. Most patients who have scoliosis do not ever come to the point needing any sort of treatment such as a brace or surgery. I am one of the 0.01% of the world population who got to the point of needing surgery. I feel I'm unlucky that I am in this small percentage, but I also feel like I am lucky I fell into the hands of such trained doctors and professionals who were able to help me. 5 years ago, I was crooked and in pain. Now, my spine is in line. Thank you. At this time, I'll take any questions if you have any. Yes?
What was the name of the test used in schools, and how did they perform that test?
This is the Adams forward bend test. Basically what you do, it will look weird on me because I have a straight spine and won't be crooked, but you put your knees together and you turn to the side. You bend forward with your arms hanging downward, and they'll look at you both from the side, the front, and the back. And they'll be looking to see if the top of your back is different heights as well as the bottom. Any other questions? Yes?
Do I have to come? What have been your symptoms since you had your corrective surgery?
In the recovery process, which was about 2 months of basically laying on the couch and walking around, there was a lot of pain. It was very difficult to walk. I had to kind of learn how to get myself in and out of bed, in and out of cars, basic things I didn't expect. Since then, I was a swimmer in high school. I had to retrain myself how to do flip turns because I couldn't bend my back in certain ways. But besides that, now I don't really notice it. It's just kind of become natural. My posture is always straight. I don't have to slouch anymore, but now I don't notice it as often.
As a follow-up, were there any things you can't do?
I can't bend my back, so anything that restricts any sort of motion in this direction, I can't do that. Also, it does limit my rotation side to side as my rods go about to here and they start up at the top of my neck, or bottom of my neck. Yes?
How often do you see your doctor, and what does he look for?
After your surgery, you see your doctor 2 weeks after the surgery, and then a month following the surgery, and then 6 months. And then you just see them every year, and you just go get an x-ray, and they're making sure that everything stays the same, which it usually does. I know I've seen my doctor, and every time he just tells me that nothing's changed, and he's not expecting anything to change. Is there any more questions?
I have one more.
Okay.
Do you have any history in your family? You mentioned family history as being associated.
Yes, I do. We didn't know that prior to discovering my scoliosis, but some of my grandparents do have scoliosis. They just have minor versions of it. Any other questions? Thank you.